Hello, everybody. We got the word that you can hear and see us. There's about 50 people who are online at this point, and the number's continuing to go up. And my name is James McJunkin. I'm the executive pastor of the Philadelphia Baptist Association. And I called Commissioner Thomas Farley. We had spoken with him in June of last year, and I wrote to him and said, well, it looks like the fall and winter, there's going to be a surge in COVID, and we need to be prepared for that. And would you be interested in speaking with the people from the Philadelphia Baptist Association again? And he said, very much so. He wrote me back the very next day, and I was very delighted to get that response. And so that sets up the conversation for us. We know that the virus is growing, spreading all across the nation. Hospitals are being stressed, and I'll let him talk about what's going on. Dr. Farley, would you take it and introduce Shara, and you all share for a while?
Yes, thanks very much, Reverend. So first I want to introduce Dr. Shara Epstein, who's joining me tonight. Shara, you want to just say hello so that your picture appears on the screen so that they can see you?
Sure. Here, hi, I'm Shara Epstein. It's nice to be here.
So Dr. Epstein is an infectious disease specialist who has now joined the health department in the division of COVID containment, as we call it. And so I won't always be involved in some of these conversations, but we want to continue to have the conversation with you and everyone else here in the audience. So I want them to have a chance to meet Dr. Epstein as well. So she may be here on future conversations. So let me just talk a little bit about where we are with the epidemic and where we may be headed with it. And I did, as Reverend McJunkin said, I was enthusiastic about having this conversation because you folks are opinion leaders. You're people that your average folk listen to and pay attention to. And there's a lot of important information, a lot of sort of judgment about this that people need to have. And so we want to make sure that you are up to speed on all this and you have a chance to get your questions answered, both now and then, especially as we get future into the period of vaccination, which I'm hopeful about in the future. So I'm going to try to share my screen here and show a brief PowerPoint to explain just where we are with the epidemic. And let's see if we get the technology to work here. Share my screen, and there's that. And there's. So are you seeing my PowerPoint presentation?
No. Yeah.
No, we're not seeing it.
All right. What are you seeing?
You.
See me?
Yeah.
All right. Let me try this again.
Now it's there. Something's up. Yes.
How's that?
There we are.
All right. Great. So first, just the overall impact of this epidemic. Over 47,000 diagnosed cases so far. Means about 3% of the whole city of Philadelphia at this point has now had a diagnosed case of COVID. Close to 7,500 people hospitalized. We had just added more deaths today, so close to 1,900 people have died. Of those people who died, 50% of it in nursing homes. So this has been a tough epidemic already. It's had a pretty big impact on Philadelphia. This is just a graph of the deaths by race. And as you can see here, close to 50% of the people who died are African American. That's the largest racial group that's died. Close to 30% white, but no racial group has been bypassed here. But certainly African Americans have been disproportionately hit here. And if you break it down by age, you see that you probably not news to you, but this is very, very age dependent. We have most of the people who die are above the age of 60, many above the age of 70. But so younger people tend to handle this infection pretty well, but this can be very tough for people who are over 60. And that's over 60 these days to me doesn't feel very old. I'm in that category, so we certainly have to be concerned about that. This is our trend in the epidemic so far. It's a bit of a complicated slide, so I apologize for that. The orange bars there are the number of cases we're seeing by week. And the black line is the percent of tests that are positive by week. You can see in the orange bars, we're now seeing a big increase since late September. And we're now, this slide is even just a few days out of date, now actually hitting weekly case counts that are higher than we saw last spring. So more cases than ever. Now, partly that's because we're testing many more people than we did before. And so another way, maybe a better way to look at it is to look at the percent positive. We're now about 10% of people who are tested are positive, and that's where we were in, say, early May of the spring. So we're not as bad as we were at the peak of the epidemic, but the trend is very worrisome. We're definitely going in the wrong direction on this. And it shows that this virus is behaving like other respiratory viruses, that they tend to get worse in the fall. They tend to peak in January and February and then ease off. So we're entering that very tough period right now. And that, the most dangerous period, certainly since this virus first arrived here last spring, and with the potential for it to maybe be even worse than what we saw last spring. And this is just a map of the case rates by zip code across the city. And don't get, the darker the red, the higher the case rate. That's, cases per 10,000 population. So don't get too concerned about the gradations. The main message here is there are high case rates in every zip code in the city. This virus is everywhere. It's every population. I look at these maps, every day, and every few days you see the pattern looks different. It's moving around constantly from neighborhood to neighborhood, but it's high everywhere now. And this is where we are with the number of deaths by week from the beginning of the epidemic till now. So in the springtime, we were having as close to 250 deaths per week, which is awful. Now we're down about 10 to 15 deaths per week. We haven't seen an increase significantly in deaths with this increase in cases yet, but we expect to. This is just an estimate that I've made, some simple sort of guesses based upon what happened elsewhere, what might happen. The gray bars are how many deaths per week we've had so far, and the reds are what might happen. So we may be up to 200, 300 deaths per week by the end of the year. So that really concerns us, and we're trying to see what we can do now to at least flatten that curve, have the deaths be fewer, even if we can't prevent all of them. And what do we know about where and how this virus is spreading now? Well, when we do our contact tracing work, where we're trying to see who got infected and how they notify those who were exposed, in the process of that conversation, we learn about where the virus is spreading. So we know it's spreading within households. Once one person gets it in the household, often other household members catch it. That may not be possible to prevent, but we're also seeing other spread amongst social contacts and relatives. So when a relative goes to somebody else's house to visit their uncle or cousin or sister, we get a lot of spread that way. A lot of spread through small social gatherings. A group of 5 people get together to watch a football game. A group of kids get together after the soccer game and have a pizza party. Lots of spread like that. So spread in carpools. People are afraid to take SEPTA. Now they're going to work in carpools. Well, getting in a car with someone is very close exposure. So getting spread there. We're getting lots of stories of spread at weddings and funerals and other celebrations. Office type workplaces, we're seeing some. Typically when people get together over lunch and they take their masks off and they get around a table, that's a high risk situation. We are seeing some evidence now of spread within restaurants. And we have about 95 schools, excuse me, that are doing in-person education. They're not public schools, but there are schools. And of that, we have 3 schools now where there's evidence of spread within schools. So most of the schools are not having a problem, but there are a small number that have. So what are we going to do to try to prevent this surge of cases and surge of deaths in the fall and winter? We want to encourage mask use whenever people are near people other than their household, whether you're indoors or outdoors. That means at work, it means at school, on errands. We've got to do a better job with masks. We're actually tracking mask use, and about 75% of the time when people are going into a store, they're wearing a mask. 75% is pretty good, but it's not good enough. It needs to be more like 95 or 99%. So we really have to get mask use more consistent. Then these gatherings are really risky. We have to discourage the gatherings. And I hate to say this, but no weddings right now. Weddings are really dangerous. Funerals are dangerous. Just people getting together for a birthday party, that's very dangerous. If people have to gather at all, if they insist, they need to do it outdoors, and need to always be wearing masks, and they need to still stay 6 feet from each other. We need to discourage visiting between households. This is so much of what makes life wonderful for us, is visiting with people, visiting our friends and relatives, helping them out. But that's how the virus is spreading. So we need to discourage that for this difficult period. And then I will recommend, because this is a group of ministers, returning to online religious services. Church services are dangerous just by the number of people that are in the church. And even if they're wearing masks, the masks are not perfect. And so during this very tough period that we're approaching now, the next 3 months, I would recommend returning to online only religious services. So that's the bad news. Now let me talk a little bit about the good news and the hope for the future, and that is vaccination. There now are about 6 vaccines that are in the last stage of studies to see how safe they are and to see how effective they are. Just earlier this week, the first vaccine we saw by press release, more than 90% effective. That's very exciting because that vaccine, of all the ones, I would say that's the one I was thinking might be the least effective. So if that one works, then I think the other ones are likely to work as well. So it's very exciting to hear that. What we're being told is that the first dose of that vaccine may be coming to us in late December. Maybe they're off on their date, so maybe it's early January, but it's pretty soon. It will not be in large doses and in large amounts. We're only going to be able to vaccinate a certain number of people. And so initially, we will be vaccinating people who are at very high risk for either dying from the infection or who are at high risk to spread the infection to someone else who may die. So a healthcare worker, for example, a person who works in nursing homes would be very important to vaccinate so that they don't spread it to nursing home residents. Between, let's say, January and June, we'll gradually be getting more doses produced and more that will arrive here, so we'll be able to vaccinate more people. So just taking a wild guess, I'd say maybe around April is going to be the time when enough will be available for anybody who wants to be vaccinated. That'll be great. And then I'm hoping that, by the summertime, we've got a lot of people covered. And so we're really not seeing much spread of the virus. We have to tide ourselves over until that point, though. We're entering what is, again, maybe the worst part of the epidemic over the next 3 months. We've got to be especially careful then. And after that, then the vaccine can start to help us out. So that's getting back to this conversation. That's why this conversation is so important. People need to understand how important it is for them to take these safety precautions now. The behaviors that they did 2 months ago and got away with, they're safely, are not safe now because we're in a different season. And if they can just hang in there a little bit longer with these difficult restrictions, there is light at the end of the tunnel with vaccination in the spring. So with that, I'll stop, and I'll be happy to open up the conversation for questions or any sort of discussion. I think you're on mute, Reverend McJunkin. We can't hear you.
Thank you very much. Reverend Harding, you need to unmute as well. And so there were some questions that were sent by participants in advance, and he's going to ask you those. Anybody that's got a question that you want to ask, you can type your question in, we'll see it. And we can also ask some questions directly from participants on the chat now. Okay? Ed?
Okay. Our first question is, obviously you said that churches should go back to online services. So are we looking at January to going back to worshiping in our places of worship?
You know, it's a fair question, and I would love to be able to say, yeah, in January you can do that, but probably January is going to be the worst month of all this. You know, maybe February, maybe March, but it's probably going to be longer than January.
And then when we do start to open up, is it going to be, I guess, small capacities again?
Yeah, I think a gradual restarting of activities is the safest way to go. We're still learning about this virus, and at every step, I think, should always be a slow and careful step to see if it works.
Thank you. And in your research, what are some of the factors that you've learned about the outbreak with churches and congregations?
You know, we haven't seen much evidence of spread in religious services. We've had some. The one that stands in my mind the most was a church where people were close together not wearing masks. And so they weren't following the basic precautions. We have seen more spread in gatherings that are not necessarily a regular religious service, but it may be tied to it. So it may be a wedding, for example, or it may be a funeral. Lots of evidence of spread there. I think in those settings, often there's food involved, and so people are not wearing masks. So the basic principles of masks and distance still hold, and they really work. The hard part is just really making sure that they're followed consistently.
Okay, thank you. And one last question. As ministers, what can we do to inform our congregations and our members the best way we should practice safety in our congregations and in public?
You know, there's a lot of misinformation out there. I'm not sure what people are looking at online, but there's a lot online that probably still saying this is a hoax, or the virus is just going to go away. It doesn't really affect anybody these days. I think simply reinforcing the basics that no, this virus is serious. It can kill people. Most people will do fine, but it definitely is going to kill some people. And so because of that, we need to take precautions. And that the most important things are these simple ones. Mask when you're around anybody who's not in your household. And during this tough period, avoid being around people other than your household as much as possible.
One other question, do you see, as it getting worse, will things start to shut down that are open now?
And so we are looking at restrictions in the city that we might put in place to try to slow this increase that we're seeing now. We don't have anything to announce yet. I don't have anything I can tell you tonight, but definitely all restrictions are possible, from right on to the lockdown we did in the spring to something that is much more targeted. We're trying to figure out how to have as big an impact as possible while minimizing the disruptions caused by these the restrictions.
I have some additional questions if that's the end of yours.
Yeah, they're the ones that were sent to me earlier.
Okay. I think I'm unmuted so I can ask my questions. So contact tracing, isolation. When I sent you a note, I saw something that said that Pennsylvania wasn't doing well. And I don't with contact tracing, I don't have any idea what that means specifically for Philadelphia. What's going on with that?
Yeah, so we hired some 130 odd staff to do contact tracing. And the way that works is when we learn of a positive test, we call the person who had the infection and we ask them to tell us who they were in contact with for more than 15 minutes within 6 feet. And those people we call their contacts. And then we call their contacts and say, you were likely exposed to someone with COVID and you need to be in quarantine, separated from other people for 14 days so that if you develop the infection, you don't pass it on to others. And that process can work. That process definitely can stop the chain of transmission. We started it in about July, and we've been working furiously on it since then. What's happened though now is that the virus has spread so quickly with the change in the weather that the number of cases we're seeing is way higher than that 130 staff can keep up with. We had 800 cases just reported today. So many of those people these days are not going to get a phone call from our contact tracing team. The contact tracing is just, it's overwhelmed. So we're going to be providing more general guidance. And if you have a positive test, you may get an email or a text from the health department that says, here's what you need to tell people you've been exposed to so that they can prevent the spread to others. But we're not going to be able to do the individual case management that we were before. Now, at some point, the cases, after they rise for a while, they're going to be going down again. When they go down again, our staff are still here. We're going to be able to do more of the contact tracing and hope to use that to ultimately mop up the last few cases as we get towards spring or summer or maybe fall of next year.
Is the vaccine provided in 2 doses? How does that work?
Yeah, there are going to be several different vaccines probably that are licensed, and each vaccine is going to have a different way you're supposed to use it. The first vaccine that's going to become available probably in late December is given in 2 doses, 21 days apart, 3 weeks apart. And so we're going to have to track people. So we'll put them information in a database when they get their first dose, and then they'll get a reminder to come back in 3 weeks to the same place to get that second dose. It's going to get complicated when there's more than one vaccine that's licensed. Some vaccines only require 1 dose. Some require 2 doses, maybe a different interval apart, maybe 28 days. And there's no research on what happens if you mix them. And so we're not going to recommend mixing them. If you got the first dose of vaccine A, you need to get the second dose of vaccine A, you shouldn't get the second dose of vaccine B. So it's going to get complicated, but at least the first vaccine is going to be out 2 doses, 21 days apart.
There was some discussion about the Army being used or to help distribute the vaccine, or what's the federal plan if there's one? How are we going to make sure that the vaccines are distributed?
Yeah, so that the Department of Defense is involved in the vaccine distribution at the federal level. But what's going to end up happening is the vaccine will be distributed to sites in Philadelphia designated by us, the health department. And then from there on out to people who need to be vaccinated. So in the beginning, it'll probably be a very small number of sites because we have a small number of doses, and a small number of sites for people who are like those healthcare workers or people in nursing homes. Later, there'll be many, many more sites available. And so you will either be able to go to a clinic, maybe the regular place where you get your medical care, or there may be a pop-up vaccination clinic we set up, and we'll let people know where they can go to get the vaccine. So at the city of Philadelphia level, the Army really won't be involved.
So I heard President-elect Biden say that the vaccines were going to be for free. And we got a question here asking whether vaccines will be covered by insurance. Well, how are we going to make sure that there's some equity with regard to income and being able to receive treatment?
Yeah, so the vaccines themselves will absolutely be for free. The federal government has purchased all these vaccines from these companies, and they're just going to give the vaccine out. Now, there is going to be an issue of if your doctor is vaccinating you, the doctor will want to be compensated for his time for delivering the vaccine into your arm. And so it may be that he's going to ask for your insurance card to bill the insurance company for the administration of the vaccine. However, there will be a setup. So if you don't have insurance, that's fine. He'll get reimbursed separately from the federal government. But so people may be asked to show their insurance card, but everybody will be vaccinated free of charge.
It sounded like that the vaccine was going to be available for mass distribution toward the end of the summer. Is that what you were saying? It sounded like you said it might even be earlier.
No, we really haven't been given any solid information about how quickly they can ramp up production of the vaccines. We've been told the first doses are going to arrive in the late December of this first vaccine. But I don't know how long it's going to be after that. So I'm guessing that April is when we're going to start to see enough of it out there that people can get it. But that's a guess. I could be wrong on that.
So basically you're telling us, wear your mask, do all the things, the precautions, stay safe, get through, and January is going to be the worst of it, and there can be a tremendous spike, and then we'll begin to see slowly the vaccine coming out, and we're going to have to manage as best we can, be as safe as we can as we wait for that to happen. And with regard to testing, there'll be some, but it's overwhelming the system. So
just to clarify, so testing is, we got lots of testing available now. It's the contact tracing where we're overwhelmed. So we have more than 60 sites in the city where you can go and get a test. You get tested free of charge. So that should not be a problem. It's just that we won't be doing the contact tracing.
Well, this one may sound crazy, but I don't think it is, or at least I'm curious too. Somebody wrote and asked about this sinus infection thing. How do you know the difference between this sinus stuff that's going around and COVID? It's kind of scary. What's going on with that?
Yeah, COVID is, it can cause very mild symptoms. It can cause no symptoms. So there's really no way to tell, if we know what the most common symptoms are, and those are going to be a new onset of cough that's persistent, on a fever, and just feeling tired. But almost any respiratory symptoms could be COVID. And if you're not sure, get a test, and you may be surprised.
I think that gets to most of the questions. The only one that I saw that remained had to do with even if we only have a few people in the church at a time, can we still have it? Your recommendation seems to me that it's safest to just go back to live broadcast or the Zoom and all that.
I think so now. I mean, I can understand that question, and you've probably been able to do that safely. But what was safe in September is not safe in November, and is not going to be safe in January. And so we want any activity that gets people out of the house, near other people, introduces some level of risk. And so I would rather people stay home with their family, their household members, away from others. And so if you could go to online only for this tough period, I think that'd be the safest.
Okay. We are moving along much faster than I expected that we would today. And I'm not going to drag it out because I know everybody's on Zoom all day, every day. There's one question about government mandated masks. Is there a possibility? I'm sorry. Would you think that's going to be mandated? And is government going to help pay for it?
Well, actually, you may not be aware of this, but in the city of Philadelphia and the state of Pennsylvania, you are currently mandated to wear a mask. Now, there's no enforcement of it. There's nobody that's going to write a ticket to you or throw you in jail for not wearing a mask. But it is stated that you must wear a mask when you're in public or around other people. And we learned that just by making that a mandate, even if we don't enforce it, that people are more likely to follow it. So now the government, just for practical reasons, we're not distributing masks, but masks are pretty cheap. And I've seen people can find ways to get masks. But yeah, so a national mask mandate isn't going to help us, but it will help the parts of the country that don't currently have a mandate like we do in Philly.
Okay. Yeah, there's a question asking about will a video presentation be made available? Yes, we are recording, and like last time, we'll put the video on our website so that other people can benefit from our conversation today. And somebody was asking about there being in the rural parts, not in the city itself. Do you recommend that they return to an online service in that scenario?
I would. In the spring wave of this epidemic, it hit the city much harder than it did the rural areas. But this current wave, the rural areas are hit as hard, if not harder, than the city. So that it's not safe being out in the rural areas. I would say the same precautions should be held there, should be followed there.
All right, I'm going to ask one last question. I have a question here. Would you please discuss the possibility of reinfection?
Good question. There have been now a couple of instances where they've actually proven that people can be reinfected. They get the virus, recover, and then some number of months later get the virus again. It's pretty rare. We don't think that this is a common thing. We hope it'll stay rare. And so if it were common, that would be a problem because we're hopeful that if you get this infection, you have antibodies to it, and then you're protected for a while. So I'm hoping as we continue to get studies in this, we'll learn that it's still rare. And I also am hopeful that it's quite possible the vaccine will be more protective even than the immunity you get from getting the infection. So even if you aren't protected from this infection by getting the infection itself, you might be protected for a while, maybe forever, maybe for a few years, maybe for a year with the vaccine.
All righty. I want to say thank you again for being willing to talk to us, because it's a pretty frightening thing and carry a lot of anxiety trying to make it through this pandemic. So when people like you are willing to come and talk with us and share so that we can plan and we can provide support and instruction for people, it's a real meaningful thing. So Commissioner Farley, thank you very much for your time today. And Dr. Epstein, we appreciate your being here. And I got the clear message that it may be you that we're working with the next time we need to have this kind of gathering. So thanks again.
So, Reverend McJunkin, can I make one last comment before we sign off?
Yes.
That is, as we get into the period when we have the vaccine available, we have concerns that people might be afraid to take the vaccine, that they're worried that it's unsafe. And so we still, Dr. Epstein and I haven't seen the studies yet. When the vaccine comes out, we're going to look at the studies and see, whether we think it's safe. If we think it is safe, we want to come back to this group and say, we've looked at this, we think it's safe. And then we hope that you'll pass on that message to your own congregations, because they will look to you for guidance on this. And that's why the group is so important. We want people, we don't want anybody to die from the infection because they're afraid to get the vaccine. Now, I can't say the vaccine is safe now because I haven't seen the studies. But if we see that, we want to be able to have that conversation here, and that would be a huge help to us.
We'll make sure that we set up an opportunity for people to talk with you at the point that we need to discuss this distribution of vaccines.
Okay, wonderful.
Thank you very much. Thank you again for your time. And to everybody that signed on, we really appreciate you. We hope this is a benefit to you. And we want to say good night to everybody and take care.